What's most amazing today is that Congress gave $10 million to the Department of Defense for MDMA-assisted therapy research in active duty soldiers.
Oh, wow.
So there's a $4.9 million grant that went to Dr. Aaron Wolfgang at Walter Reed, and it's going to be giving MDMA-assisted therapy. There's another $4.9 million grant that went to a group called Strong Star that's in San Antonio, here in Texas, elsewhere, and they're connected with Emory University. And so they're going to combine MDMA with a therapy called prolonged exposure, where you talk about the trauma over and over. But that's very re-traumatizing. There was a study that the Veterans Administration did that took them about 6 years. It was 916 veterans, and it compared two therapies that they use, both non-drug therapies for treating PTSD. One was called prolonged exposure. The other was cognitive processing therapy. And what they showed is that around half the people are in the study drop out because the therapy itself is re-traumatizing.
Oh, God.
Because you're just forced to go over the trauma, over and over, and that's supposed to desensitize you. And if you can stay in it, it can be helpful, but it re-traumatizes so many people. So what we've shown is working with the MDMA with the veterans is that they're able to process the trauma, that the fear reduction from the MDMA, reducing activity in the amygdala, the fear processing part of our brain, that you can, once you can approach these things that have felt like will tear you apart, that they'll be overwhelming, you can't really go away from them, but they never really leave either, that then you can process it. So this study that will be done here in Texas with active duty soldiers, again, is going to be a combination of MDMA with prolonged exposure. The Walter Reed study is combining MDMA with what they call acceptance and commitment therapy, different kind of approaches.
How do they decide which approach?
Well, this is going to be research trying to different kinds
so there's going to be do multiple ones and just see what's the most effective.
Yeah. And I think that MAPS has started funding studies combining MDMA with cognitive processing therapy as well. But the one that I think is the most, potentially the most valuable is called cognitive behavioral conjoint therapy. Conjoint means couples or dyads. And so what happens is the designated patient, the veteran with PTSD, is where the attention is focused. But when they have PTSD, it affects their families, it affects their partners. And so cognitive behavioral conjoint therapy was developed by this woman, Candace Monson, at the Boston VA.